This topic, so I'll talk a lot about, there's going to be a lot of information tonight, like way more than actually I've ever put into a presentation before. And there's just a couple of things that I'm finding out. I've been researching and kind of around this topic since I was still in school, in chiropractic school. And I'm going to go over a little bit of that. And so I'm Dr. Abby, if you guys already didn't know. This is our office. So thank you guys for making your way in here. This is a topic that's kind of hot right now, right? Would you guys agree with that? Do you hear a lot more about it in the media or whatever? Not enough, I would say, but they're using different things in the media or different tactics in the media from what I'm hearing most of the time, right? And a lot of the time, the things that we hear are like statistics. So I'll go over a couple of those things too, okay? So a little bit about me, just a couple of things. I am a pediatric and family chiropractor. That's actually how I started. Backtrack that, how I got started into chiropractic care was I met my mentor, my old mentor, at Starbucks. So I served him coffee every single day. And at that point I was still an undergrad, and he said, you know, hey, I said, what do you do? He said, oh, I'm a chiropractor. And I said, I don't even know what that is. I was in my 20s and I don't know, I didn't ever relate anything to chiropractic care, right? Find out later, my parents actually used to go, and it was from this, we actually worked together eventually to the one that my parents used to go to. But so that's how I started. I interviewed for a job and I didn't initially get it. And he said, and I called him a couple weeks later and I said, hey, what's up with that job, you know? And he said, oh, the girl that I hired that wasn't you, she didn't show up for work today on her first day, so you're hired. And that's how I got the job. So that's really interesting. And that's how I kind of got started. And so I worked with him for many years. I even interned in his office. And in school, I was really interested in actually different things before I got into pediatric and prenatal chiropractic care. I was really interested in sports medicine. When I was doing my internship at his office, he actually helps the women's water polo team, the U.S. water polo team. So I was really interested in functional performance and like peak performance of sorts, until I started getting into, you know, kids and different things like that. And I just kind of saw the big impact that, you know, kids these days are a lot sicker than ever. And most people are not really paying attention to that, or kind of turn a blind eye to it, right? Blame many other different things for all the things that are going on. And I think, really, I believe that every person, not just every child, but every person deserves to live a full life of their full potential, right? And so when we're talking about those kinds of things, it's hard to sometimes imagine that, right? Kind of in the daily grind of things. And so this is why I really got interested in that. I actually was Webster certified. Has anybody ever heard of that before? Webster certification is specific to pregnant women. So pediatric and pregnancy, they have specific technique to actually adjust a pregnant woman, right? And most women don't know that, and I'll talk about that a little bit today. So I actually got certified with Webster while I was still in school, because I was too excited to take it. And I said, you know what, just mail me my certificate after I graduate and get my license, because they don't usually certify you until after your license. But I was just so interested in the whole thing. And my focus in this office is neurodevelopmental. And how that even manifests in adults too, right? Because kids grow up to be adults, right? And how that is really taking a toll on all of our healths, not just, you know, neck pain, back pain, right? As I got out of school, even though I was interested in this type of stuff, I actually started off in practice as the traditional kind of chiropractic care, where it was musculoskeletal, neck pain, back pain type. Because that's what I knew. That's where I worked, and that's what I knew. Still researching this on the side. I actually am a member of the ICPA, that's the International Chiropractic Pediatric Association, and I'm a member of that. I've taken all the courses that they have there. The last part of it is actually just the research to get a diplomate. And really what makes our office different, and what makes chiropractic care different, at least in this office, is this word here, salutogenesis. Has anybody ever heard of that before? The approach of that is totally different, okay? Salutogenesis is approaching the focus on factors of human health and what actually makes us healthy, right? Rather than really focusing on symptoms and what makes us really sick, right? Would you guys agree with that? That most of the time doctors really focus on managing our illness, right? And kind of keeping us in that state of management. And really the focus of salutogenesis is to increase your health, right? And most people don't think about those things. Now this is a story, and this is from my mentor's office. This girl is actually nonverbal, right? And she came in, and it was one of those things where the tantrums were just, severe, right? Severe, and she was nonverbal. And after her first adjustment, she actually got up off the table and smiled and said a word. And so when people think about that, it's really offering a sense of hope to people that there is a way out of it. And you don't have to do it in the way that's traditional or the way that they're suggesting to you maybe even now, right? I know I actually went to the Thinkers for Autism event over the weekend, and moms were saying that a lot of the time their kids are sedated, right? And when somebody's sedated, do they express full health potential, full life, right? Regardless of anything, nobody deserves that. Nobody deserves a life of numbness and not being able to feel, right? So it's pretty significant. So what I'm about to talk about tonight, like I said, there's going to be a lot of information, and I'm going to try to keep our energy up because it is a lot of information. But all the research that has been done and is in this presentation is in all of these different books and also journals. Okay, so it's all research-based, all science-based. And don't worry, because if you actually signed in to our to the sign-in sheet up front, you'll receive a series of emails from me about all of these different things and all the research that I'll be talking about tonight. So if that helps anything, okay? And so these books are really great. The Brain That Changes itself, I just saw that on YouTube. There's a free documentary on it. I don't know if you guys have ever seen it before. So I'll talk about that a little bit later in the presentation. Okay, so there's 3 things that I really want to talk about tonight. What is really going on? Why is this happening from the eyes of chiropractic care, right? From principal chiropractic care. And what's next? How do we move on from this? Where do we go, right? So before we do that, let's talk about some statistics, okay? And I kind of just looked this up today. Did you guys know by the time it's 2020, it'll be like 1 in 20 kids? Yeah. I mean, a few years ago, I went to a seminar called CalJam, and they were saying it was 1 in 68. And that was a few years ago. Just like a couple of years ago, not even a few, like a couple of years ago. And so back in the 70s, 1970s, like hardly anybody was talking about autism, right? And you're going through what's going on, and why are the numbers increasing so significantly every year, right? And even then, not even with autism, but 11% of 4 to 17-year-olds have ADHD or diagnosed with ADHD. Okay, and most people don't know why. And actually, I was doing all this research from before, and they were saying that, the diagnosis has just gotten better. Right? Have you guys heard of that before? That people are just doing better checks and diagnosing them better, and that's why the numbers are increasing. And I'm going to talk a little bit about that also today. The next one, this is pretty significant to me in what I saw. Going with that ADHD statistic, kids who are diagnosed with ADHD, over time, by the time they reach a certain age, they have more tendency to actually abuse different substances over time, right? And then a lot of them might have mood disorders, right? Eventually. And anxiety disorders is the highest one. Okay? Pretty significant. And the next thing that I saw, OCD is now affecting 2 to 3% of children. That might not sound like a lot, but when you're talking about numbers, that's 2.2 million kids being affected with OCD. And by the way, back like several years ago, OCD wasn't even a thing for children. It's like an adult type thing, but now it's happening in kids. Why is that? Right? It's pretty significant. 1 in 8 or 9 million have an anxiety disorder. These are pretty astounding numbers. And these are all from the CDC website. Okay? The next one that I found, 43% of people, or 32 million, have at least 1 of 20 chronic conditions. Kids, these are children. We're all talking about children right now. So children will have at least 1 of the 20 chronic conditions today. Okay? Does anybody have any questions so far? Now, when you're kind of talking about the autism spectrum, right? They're like I said, they're talking a lot more now about how it's just getting better at the diagnosis, and that's why the spectrum is increasing. Okay, but when you're really thinking about it, when you're examining, and a lot of doctors these days blame it on genes. Has anybody ever heard that before too? Yeah, they blame it. There's a gene, right? Now, if the genes are actually the problem, and the rates keep going up significantly each year, we all know, based on just biology, that genes don't change that rapidly, right? So autism isn't really on a gene, right? And those different books will actually tell you that.
Is it possible that something's causing them to express themselves, or they weren't expressing, their genes weren't expressing themselves?
Great segue, Dan.
Okay.
Absolutely, absolutely. And so has anybody ever heard of PANS and PANDAS? And so my mentor actually, who I was doing all this research with, right? His child actually eventually acquired PANDAS, right? So this child, he's a chiropractor, and this child is living the chiropractic lifestyle. What does that mean? All organic foods, never been vaccinated, getting adjusted every week, right? And I think his son was about 2 years old, is what he was saying. And they went on a trip somewhere, and this child started to have these different symptoms of like aggression, right? And just a multitude of different things. Now, PANDAS and PANS is actually a virus caused inflammation in the brain. Okay. Pediatric acquired it's a long word. And it's caused by the strep virus, right? And so most people don't even know about those different things, but yet we actually go towards many different avenues in how we actually manage the symptoms of the child without actually looking at what's really going on. Like, why is this really happening? Now, I want to ask this question: how do mechanical systems work, and what do they need? So, like a car, it needs parts and also needs power, right? And what's the last thing that it needs? Information, okay? Many people really focus on parts of things, right? Like the engine, or like that would be a part, correct? The power would be coming from like the gas, right? But really, what's the most significant part of this car in order for it to function? The person driving the car. So that's the information, right? And so a lot of us are thinking of, the parts of our kids, or we're handling this in this way, or this in this way, right? It's all separate things. But really, what is the most important part of somebody or of a person? It's their nervous system. So that's what we'll get to in a few minutes. How do computer systems work, and what do they need? Same thing, right? Essentially, mechanical systems work in the same way. Much like us, right? What about us? What do we need in order to stay healthy? We need our parts, right? We need our organs, different things to work. We need power. We get that from what? Different types of food, right? Nutrients, water, sunlight, right? Information. How do we get information into our system?
Our senses.
Exactly. The 5 senses. What do living systems need to work properly? All those different things. Because systems are made of parts, they all are designed to what eventually?
Wear out.
Have you seen this presentation before?
No.
Breakdown, absolutely. Absolutely. And that's why, none of us live forever. right? That's why none of us live forever. Eventually, those parts actually start to break down. Okay? What happens if you take away or disturb parts, power, or information of a human being? What would happen? Like, what if you never went out in the sun? What if you didn't exercise? What if you ate McDonald's every day? What would happen?
You'd be very happy. No, just kidding.
I don't know about you. I don't think that's you anymore.
No.
Or ever, right?
Right. Things would break down.
Right.
It would deteriorate rapidly.
Exactly. So what if the symptoms that our bodies are expressing or our children are expressing is actually an expression of where the parts are not connecting correctly? Like, what if that were the case, right? Has anybody ever thought that could actually help an autistic child? Never. This is the first time you guys are hearing about this? Wow. Okay, so that's what we'll get into in these next few slides, right? How would chiropractic care actually help a child who has autism? Or how would chiropractic care actually help anyone, for that matter? Or moms who have children who have autism, right? Things like that. So this is a little chart, and I was moving it, so okay, good, because this was like all the way down when I saw it. So this is what's called the neurodevelopmental quadrangle, okay? So everybody knows, everybody talks about the genes, everyone. So that's why it's in the middle. Everybody talks about the genome, right? The genes of someone, because everybody's really obsessed with almost what they can't control, which is the blueprint. When you're thinking about the genes, it's essentially a recipe for something, right? Somebody has to cook the recipe in order for it to come out, right? Would everyone agree with that? So that's what the genes are. Oxidative stress essentially is the daily wear and tear on your body, right? Have you guys heard of that word before? Oxidative stress, right? Oxidation. Now, when you're looking at all of these different things, it kind of goes in a loop. That's why all of the different things point to each other, right? Because it's not just one leads to the next, right? It's kind of like a just roundabout type of thing. And so when you're looking at the environment, multiple toxins and malnutrition, would you agree today? I mean, I was looking this up even, like when our grandparents were young, they had more nutrient-dense food than we have today, right? And there's many different causes of that and why that's happening. And so most of us, even if we don't have the affinity or the genetic, tendency to have these different mutations, we are already susceptible to these different things. That's why a lot of people are sick. Even if you don't have autism, you are, eventually feeling the effects of this over your lifetime, right? Now, the phenotypes of autism is how the genes of that is expressed, okay? And then when you're talking about that, the neuroinflammation is how the immune system is actually correlating to how a child is expressing that, right? Immune system has a lot to do with how anybody functions in life, right? Has anybody ever heard this where they, everybody in their house is sick and then they don't get sick, right? What is the difference? If everybody is in the same household, they're all breathing the same air, we all are, or there's something called flu season, right? How come not everyone during flu season is sick? What is the difference?
Their immune system is stronger.
Their own immune system. It's actually your own immune system. And so a lot of the time what they're finding out in the research with these children is that their immune system is actually compromised. And a lot of that comes from the gut, right? Your gut is, now they're not even calling it the second brain. Now they're actually calling it the brain, right? It's actually the brain now. Because what happens in the gut, in the, people who don't have these different ailments going on, in the traditional type, you have gut bacteria, gut biome. You guys heard of that stuff? Gut biome. So there are there are lots of bacteria living in our guts, right? And they wrote this research study where the gut bacteria is actually sending information to your brain and tells you what you're going to crave.
And there's more of them than there are of you.
There's way more of them than there are of you. You're just a bag of bacteria, essentially.
Right, we're just working for them.
We're really just working for them,
Yeah.
essentially, right? And so what they're finding out a lot in these children is that they actually have something called leaky gut, right? A leaky gut. Has anybody heard of that term before? Mm-hmm. Yeah? The reader, he reads a lot. Leaky gut, essentially. So when we're ingesting any food and the nutrients are extracted from the food that we're eating, when we have a leaky gut, the barrier, right, there's actually food particles that are small enough or big enough to actually permeate through the gut lining. And that's what they call leaky gut, because it's not supposed to do that, right? That's essentially what the leaky gut is, which then turns into a leaky brain. So we'll go over that too. So neurodevelopmental disorder trifecta, genetic or environmentally induced predisposition. Okay, some people are predisposed to having these things on their genes, right? But it's the fact that their genes have to actually manifest or have a phenotype for that gene. And so what really affects that? What would you say affects the genes from expressing?
Environment.
Absolutely environment. Absolutely environment. What we're doing to our bodies, what we're, how we are when we're pregnant with our children sometimes, right? All of those different things. The food that we're eating now today also affects that. The next thing, microbiome depletion. Okay, so this is one of my favorite topics, microbiome depletion. Most people don't realize this. More than anything, when we're passing through, so let's talk about women in pregnancy, right? And that's why it's kind of in this order, but so when you're thinking about women in pregnancy, a lot of the time, what's the most common thing today regarding pregnancy when you're going to the hospital, right? You hear it all the time. People are scheduling their C-sections. People are going through and having emergency C-sections. Do you guys ever hear things like that? And so why would it be so significant if a child is born through C-section that they don't have the gut biome? Why would that be so significant? Exactly. So the very first time that a child actually is bathed in the mother's own gut bacteria or gut biome is actually when passing through the birth canal, right? That's the first experience. They're bathed in the mother's microbes, essentially, which gives them their very first immunity, right? As well as also a child breastfeeding, right? Did you guys know that a mom, when the baby, whatever the baby needs, breast milk will actually produce? Like when a mom, when the baby is getting sick, the mom's milk will actually change to help that child and whatever nutrients that they need. Isn't that so cool? So your body is actually designed to do this. Now, on top of those different things, the rest of those are also what cause a depletion in the microbiome. Okay? And then what happens when this happens chronically, when the gut biome is not taken care of, it eventually produces a leaky gut, which we just talked about, right? And then it eventually leads to autoimmune reactions. Kids who are hypersensitive to things like food, right? Peanut allergies. So many peanut allergies. Inflammation in the brain, right? So many of those different things, which turns into a leaky brain. Leaky brain is massive inflammation in the entire nervous system. Okay, yeah?
So that's from the C-section delivery.
Most of the time. So these are different things that cause a depletion in microbiome, in the microbiome.
I heard another theory where they're overexposed to antibiotics, that they're also
Yeah, it's right there.
allergy.
Yep, antibiotics. Because why would that matter? If somebody were taking too many antibiotics, why would that matter?
Even just one exposure can also lead to that.
I mean, when you're taking antibiotics, what is the main purpose of an antibiotic? Wipe out all the bacteria, even the good ones, right? Even the good ones. And so it really throws off the symbiosis in your gut, right? And I mean, you hear that all the time, even with kids, when babies are taken to the traditional, like to Western medicine, and they have an ear infection, right? You hear that all the time. What do they usually give the child? Antibiotics. And then over time, what happens to the child? Like if they consistently get the child, if the child consistently gets antibiotics, what would happen?
You kill all the bacteria.
But then if the child is continuously getting ear infections, they eventually receive an ear tube, right? Eventually. Because that's the way they kind of track that, right? If the kid gets this many in a year, then we have to put ear tubes in. But there's a reason why the child actually gets ear infections, if anybody ever thought about that, right? When you're a baby, your ear tube is actually more parallel to the ground than if you were when you're an adult. As you grow, you actually have a slant in your ear tube, and that's how it actually drains, right? And so when babies are drinking milk, whatever it is, it doesn't drain properly because it's more horizontal to the ground. And so that's why they're very, very prone to ear infections all the time. They did a study on that where they proved 80% of kids who receive ear tubes don't actually need it because of that reason, because you eventually grow out of that stage, right? Does all that make sense? Cool.
Both of my girls are allergic to nuts. My older one leans toward the tree nuts.
Mm-hmm.
My younger one leans more toward the peanuts.
And they're allergic?
They get rashes
Mm-hmm.
all around their mouth, but not to the point where they go to anaphylactic.
Right. A lot of kids are that way these days because of that leaky gut syndrome, right? That's one of the things, peanut allergies, even wheat allergies in kids, right? Eggs, those are different things that our kids are allergic to these days.
So how do you solve that? Do you do the probiotics and more organic diet?
Yeah, I was actually going to talk about that in a few slides, but yes, absolutely. So one of the steps is to actually heal the gut bacteria and the gut biome, right? Which is going to come up. So what's next? Where does health actually come from?
It's more than the absence of disease, right?
Most definitely.
Right.
Most people believe that just because they're not sick, it means that they are pretty healthy.
Is health the natural state of the body?
Absolutely, it is. Well, think about it, because if you fall down and you get a cut, what does your body do?
Repairs.
It repairs it, right? It heals. And so your body is designed to actually be healthy. Your body's designed to be healthy. What does health mean to everyone? It means different things to different people. But most of the time in the way we think today, just because there's nothing going on in our body or we have no pain, it means that we're healthy and we're healthy enough, right? Why are people now searching for alternative things to help their kids?
The current stuff isn't working.
Because it's not working at this moment. Like whatever we're doing today isn't working clearly because things are getting worse. Would everyone agree with that?
Yes.
I was doing the research for this and I was like, oh my gosh, this is a lot worse than I remember. And by next year, 1 in 20. I mean, that's the prediction that at the rate that it's going, if you're predicting that, 1 in 20 kids will have autism eventually, right? Pretty significant. Now, and I like to talk about this too, because it really highlights the function of the nervous system, right? Because even before, the first thing that actually forms in your entire body is your nervous system, okay? That's the first thing. Your spine actually grows out of that, right? It's called the neural streak, and it will actually form, all your organs will form around after your spine has formed. And this is all before you even have a heartbeat, right? Why is that so significant? Because that actually, your nervous system controls everything in your body, okay? And this is a little video of that. So this is your spinal cord. It's an extension of your brain, right? And a lot of people these days love to blame the brain, okay? There's a saran wrap covering that covers your brain. It's called the meninges, okay? That's a saran wrap covering around your brain. It anchors at your neck and at your sacrum. Those same places are actually controls your rest and digest portion of your nervous system, which I'm going to talk about, okay? Now, your nervous system, your brain, your spinal cord and your brain are so important that it's encased in bone by itself, right? Because, I mean, our other organs are also encased in bone, right? Like in your thorax, but your nervous system is actually one by one. Each one of the vertebrae cover a part of your spinal cord. So that's how significant it is. Your nervous system is like a sponge. Your brain and your nervous system is like a sponge. It actually has 11 trillion, it has to sort through 11 trillion information data pieces for you to actually even function every day. Do you notice those things?
All of them.
Right? 11 trillion information signals from your brain. Now, when you're thinking about it, and I'm sure you've heard of this before, kids are hypersensitive, right? Autistic children are hypersensitive. And what they're finding these days is that they actually don't have that barrier that like we do, where our nervous system can actually sort through 11 trillion bits of information and then theirs can't. And so they're very hyper aware of their body, or they're very hypersensory, right? And you'll notice them, they want to relieve that somehow. Maybe they'll, fling their arms or have a tantrum. And that's their way of actually releasing that sensory information from the nervous system. Now, when you're looking at this, your spinal cord is right in the middle there, but there's this really important artery that supplies all of the blood to your head and neck. It's called the vertebral artery, okay? And it goes through your spine, right? In a couple slides, you'll actually, and this is all just a pre-thing, so there's an understanding of the later slides, okay? So I want you to see this picture. You'll notice that the artery actually goes around and into your head, right? You notice that? Now, your autonomic nervous system, I like to actually refer to the autonomic nervous system as the automatic nervous system, because it's all the things that you don't think about, right? All the things that we don't think about, our heart beating, our lungs breathing, our digestion, our food being digested, okay? Now, there's two sides to your autonomic nervous system, okay? One side of it is the parasympathetic side, and the next side is the sympathetic side. Now, the parasympathetic is what's called your rest and digest portion, okay? And then the sympathetic is the fight or flight. Have you guys heard of this before? Fight or flight. Now, ideally, you want to have a balance in both, because there are healthy responses to things, right? Like if a tiger came out of nowhere and wanted to eat me, I have to be able to respond to that appropriately, right? I probably want to run for it. That's what your sympathetic nervous system is for, the fight or flight. Now, most of us, let alone our children are, in fact, always in their sympathetic mode. There's not really a balance, right? Do you ever notice that with your kids? They're always just very overstimulated and just always going. They're in their fight or flight mode all the time. Right? They're having trouble actually relaxing their bodies and their brains and all of those different things. Now, when you're in that, and just think about it, even imagine it in your own body, when you're in that fight or flight mode, what happens to you when you're super stressed out? You can't relax, and physiologically what happens to you? Your heart starts to beat fast, right? You probably start sweating. And then what happens? Your stomach starts to hurt. Why is that? Your brain, your nervous system is actually shunting the blood from the rest and digest portion into the fight or flight. So imagine if you're chronically living in that state all the time, and that was your natural state, right? Your parasympathetic nervous system is responsible for digestion, and that's why you see a lot of these kids have trouble with their digestion and have leaky gut syndrome, right? Because they're always in fight or flight. Okay, does that make sense? It's pretty significant. Now, your brain works in this way, like this picture, okay? So information, and I'm going to talk a lot about this, but also in the later slides, but as information comes into your brain has to sort it out, and like all of us, we have different filters. Our kids sometimes don't. And it actually hits the brain stem, and then it hits the thalamus, what's called your thalamus, and then it will go to your actual brain, the lobe, and then it will send out information to the appropriate area, right? But a big part of that is something called proprioceptive system. Proprioceptive system. Has anybody ever heard of that before? In very basic terms, it's how your body is able to tell where you are in space, right? Like if you're falling asleep and you were at the edge of the bed and all of a sudden you started to roll, what would happen? Your body will probably wake you up and jolt you out because your body can tell that you're actually rolling off the bed, right? Has anybody ever had that before? And that's the proprioceptive system, okay? That's the only system that does not turn off, ever. even when we're sleeping. I mean, you're already falling asleep and then you turn over and then you're jolted awake, right? All of these other things like your ocular system, your vestibular system, your auditory system, those things can be turned off. Like you can shut your eyes and then you won't have that sensory information, right? That sounded a lot like not funny in my head, but when I said it, it was funny. And so the proprioceptive system, the most proprioceptive input is actually in your spine, right? How significant would it be for a person to be able to tell where their body is in space? Just for daily function, right? Now this next one is the central nervous system pyramid of learning. So this is from a book, actually. It's really interesting. The very bottom part of it is your nervous system, the different components of your nervous system, right? Like your sense of smell, your eyesight, the hearing, and then your taste. Proprioception is at the bottom because it's actually a foundation, right? Just like when you have a baby, right, and they're crawling, they're figuring out where their body is in space, right? And they're grabbing for things and they're really getting to know their limbs, and that's part of that. Now, when you're kind of going up this whole thing, these are essentially different points in a child's learning. Okay, so as they develop in age, these are the different milestones that they hit. Okay, and then they kind of up here, this would be a function of like an older child, right? But when you're thinking about it, by the time the child gets here and they didn't learn all of these different things and there's something going on in their nervous system and they didn't learn these different things, what do you think would happen up here if they didn't have the foundation?
Wouldn't properly function.
It wouldn't properly function. And so a lot of the time, people will focus on, occupational therapy stuff for their kids, right? And sometimes that's not really the issue. Most of the time when parents think about that, that's the first thing that they actually go to. Parents that I've actually talked to, they'll say, the first thing that I did was how to manage my child's behavior, and because there's a reason why. It's the most significant thing affecting your life right now, right, is your child's behavior. And so you want to modulate that and manage that in a way, so you send them to an occupational therapist of some sort, right, to be able to behave better. But sometimes the problem really isn't there. Sometimes the problem is that they didn't learn some of these things that are significant for their development, right? You need the foundation of the pyramid, okay? So where is the disconnect? Okay, so these you could tell, these are the 5 senses, right? And this is your brain. Now what happens, like I just talked about previously in the previous slide, what happens is all of your senses actually gather information for your brain and goes through into your brain. And your brain decides what appropriate response needs to happen, right? Now everyone, like I said earlier, everyone's really obsessed with the brain. Like very, very obsessed because they think that's where the problem is, right? But what if the actual problem is that the information coming in isn't being sifted through correctly? Like what if that's the actual problem? And what actually modulates that? What actually helps that proprioceptive input, which I just mentioned earlier?
Your spine.
You took a break and you still got the right answer. Good job. Your spine has the greatest amount of proprioceptive input in your entire body. Okay? So the problem isn't in the brain. The problem isn't actually in the brain. It is the way the information is actually coming into the brain. That's the real thing. Okay? And why is that? Right? And it's this really big word that we learned in school. But it means so much more. So disafferentation is a dysfunction in the input to the brain. That's essentially what it says. That's what that word means. It's a dysfunction in the way that the information is being sent to the brain, right? So the brain's not the problem. That's what they're finding in research today, which is super interesting because a lot of us want to blame the brain. It's like this kid's brain's not working. And neuroplasticity. For me, neuroplasticity is such a magical word, okay? Probably not to everyone, but I just love that word because to me, it actually means hope. I don't know if that means hope to you guys. And I'll explain why. Neuroplasticity means hope because it's telling us that your brain can actually change. That your brain isn't fixed. That's the old way of thinking. That was like way back then. We know now, even by the mere thought of thinking a different thought every day, your brain can actually change. Adaptability, right? And I think that gives hope to a lot of parents, which it should. It means that your child is not set in this way, right? So it's awesome. And that's what that word really means to me. And this is the book that I was talking about. It was in the other side, but The Brain That Changes Itself. And if you Googled it on YouTube, you'll find the free documentary. It's like 55 minutes long. It's so significant. You hear about stories of these different people. Like I watched it the other day. It was this guy had a motorcycle accident. He had his arm cut off, right? He had to get his arm amputated. And he was receiving phantom pains in his arm that he didn't even have anymore. And so what was the disconnect there, right? When you're thinking about it, his brain still thought that there was an arm there and it was in severe pain. And the signals from his brain to that arm was going nowhere because the arm wasn't there anymore. And it was causing him significant pain. And you know what his treatment was? You probably saw this on Grey's Anatomy. They created a mirror box for him, right? So they created this mirror box for him and he put his hand in the box and it mirrored to the other hand. And so his brain was like rewiring and it was releasing his pain. So that is neuroplasticity, right? And he was able to get rid of his pain by doing that. Isn't that crazy? Wow. It's super awesome. There was another one on there that this woman had cancer and she went through chemo and chemo melted her vestibular system, which is the one that's responsible for balance, right? And she was like a floppy fish. You'll see it in the video. She was like a floppy fish. She couldn't even sit straight up. Now they put this thing on her head and they used her tongue as a sensory and they would zap her tongue and then it actually rewired her brain to create that balance again. And they related it to like if you were taking 405 freeway to work every day, it was almost like if there was a traffic jam, you took side streets instead. So that's how they rerouted the brain signals. That is neuroplasticity, right? So everything is not set in stone when it comes to the brain. You can always change it. And that's really great for the kids, especially at their young age, right? Super awesome.
Until very recently,
this is part of the video.
Our best and brightest scientists and physicians believed that the adult brain couldn't change. Our brain circuits were formed and finalized in childhood. Now we discover that the brain is plastic, meaning changeable. But not all change is good. That changing brain can actually do us harm. Obsessive-compulsive disorder, post-traumatic stress disorder, and even schizophrenia. But the mind can harness the damaged brain's plasticity to change itself. And now we are finding new treatments for mental diseases and disorders once thought incurable.
When you would tell people, hey, this is your brain sending you a false message, it would help them.
We might actually change the whole course, the whole trajectory of someone's life.
This is medicine. This has outcomes that are medical. It changes brains physically. It changes them chemically. It changes them functionally.
We do not yet see where the limits will be. There are still big new surprises.
My name is Dr. Norman Deutsch, and I wrote a book called The Brain That Changes Itself. The discovery of neuroplasticity is the discovery that our brains can change their structure and function through mental experience alone. It signals the most important change in our understanding of the brain in 400 years, because for 400 years we thought of the brain as though it were like a machine with parts, and that view of the machine-like brain gave rise to a neurological fatalism, because it meant people who were born with brain damage or who sustained brain damage as they developed were condemned to live with it, because machines do many glorious things, but they don't grow new parts and they can't reorganize themselves.
Must watch for sure. So I'm going to go through some different studies now about the brain and the actual information coming in and all those different things that happen. So primitive reflexes and their relationship to delayed cortical maturation, underconnectivity, and functional disconnection in childhood neurobehavioral disorders. So this is essentially these books that we already talked about. I think I already talked about this, The Disconnected Kid. So that's part of that book, okay? The feedback created by primitive reflexes. So I'll give you an example of a primitive reflex. So it's called the rooting reflex, right? So when you stroke the cheek of an infant and they have the correct reflexes, they will actually lean towards that. And that's a way for us to survive, right? Because they want to breastfeed or feed on some side. So if you stroke their cheek on that side, they should lean their head to that side. And that's made for us to survive, okay? Leads ultimately to the inhibition of these reflexes and to the activation of more complex postural reflexes. So it's telling us that when we actually don't have these different reflexes over time because the input isn't going in correctly, that it affects us all over time. That's how the brain changes, okay? And I always like to talk about this too because what does it take, right? It takes a village. I'm not saying that chiropractic care is the only thing that helps autism. And we're also not saying that chiropractic care cures autism. Okay, definitely not. But there is a significant impact of a very clear nervous system on the very basic sense and proprioceptive input to the brain, right? Very, very significant. It takes a village. It takes many different modalities, many different people, a team to help, your child rehabilitate through this thing that they're going through right now, right? Neurodevelopmental disorder again. So we're going to go through this. And we went through that already, right? Does anybody have any questions on that?
Does this also work for the OCD and ADHD? Okay.
Absolutely. Because the reason why is all of those different things are under the same umbrella, right? Yeah.
Now, as people develop or in age, how do they figure out that they have leaky gut?
It usually manifests in this way, right? Because if you have a leaky gut, even really large food particles actually gets through the system, right? If you can imagine that. It gets through the lining of the digestive tract, and it's not supposed to. So it'll cause a lot of different things, like actual food particles will be in your bloodstream. So all those different things actually happen, causes significant inflammation in the system, right?
So the immune system will attack them like they're bacteria.
Exactly. Your immune system will fire. It will attack you.
It was explained to me by a psychiatrist that ADHD is, my son is creating the chemical that is pushing the signals to the front of his brain to process things.
Mm-hmm.
Would you agree with that or not?
Why did you ask him why is that? Right? A lot of the people, different modalities, they want an outside-in approach, right? Does that make sense so far? It's like they want an outside-in approach, so they want to medicate a child. But the real reason is, why isn't my child producing that? Why isn't my child producing that neuropeptide or whatever it is? That's the real question, right? Because anything that's made in the body, all the drugs only take effect because there's a receptor for you in the body, right? So a lot of the time, doctors medicate children as the first thing that they do, instead of looking at those different things that we already took a look at, right? So most of the time, no, I don't agree with it. That's the answer to the question. And I have actually seen kids who have had ADD, ADHD and have resolved, right? I have a couple kids from the beginning of this year. They moved to Texas, but the child was unable to actually focus in school, right? And had tantrums all the time. And she was older. She was like 9 years old. And after getting adjusted, the mom said, she's very calm. She can actually, one of the most significant things, she actually can make eye contact, right? Now, it's not as severe as autism, but that's really significant for a child when they're able to process and not, you know, be all over the place and, you know, be able to do better in school, right? Or even have a conversation with their parent is pretty significant. And so, no, and she was on medication.
She was.
Mm-hmm. And not to mention, when you're thinking about giving your child medication, it really almost makes them reliant on that medication. And it's for life. Now, what do you think happens when you're taking this drug, or your child's taking this drug over time? Do you think they'll need more or less later? Because your body gets used to it, right? Your brain will actually adapt to that. That's how smart your body is. Your brain will adapt to that. And I hear it all the time, even people who are on antidepressant medication. They'll say, my doctor has to switch my medication because now it's not working. Now I don't have enough. That tells you something, right? So yeah, a lot of the time I don't agree with it. Does anybody have any questions about this?
I have a story about the last slide, actually. One time when I was in college, for a cheat meal, I was eating pasta like every meal for like a week, and I ended up having some gut issues because of it. And so before then, I kind of thought the whole people avoiding gluten was just like a fad. And so I did some research, and I found out that the protein in wheat that is gluten has an effect where it widens the pores of your gut. And so for that reason, it can allow food and blood to pass through that membrane. And so that...
So you like already knew that. So you probably don't eat pasta every day for a week now.
Not every day, yeah. I did for a while try cutting out gluten completely from my diet, and I felt great, but for me it was tough to sustain. So I moderate my intake, but I don't avoid it entirely.
Yeah, and that's somebody who is not compromised, right? When we're thinking about that for kids who are compromised already, who are autistic, they already have that situation going on. They don't actually develop it after a week of eating pasta. Like, they already have that going on, right? So they need more help with that. Has anybody ever heard of the GAPS diet? It's the gut and psychological diet. And so it's very carb specific, right?
Kind of keto diet, or?
Not really even the keto diet. So it's really working on healing your gut more so, and you choose specific things. So you would eliminate things like starchy things in the diet, which will affect that. So yeah, that will also be in the email. It's, you know, all of these different things that I'm talking about is like another whole thing to talk about on its own. It would take a long time. So you'll receive some links in your email about all this stuff, and click on those links and see, you know, something that can help you.
So how will chiropractic treatment help?
Oh, getting to that now.
With ADHD?
Yeah, absolutely. So when they're doing research on chiropractic care today, they're noticing now, or the studies are showing now, that it actually is eliminating your brain from going into that fight or flight mode and going into that survival reptilian brain, and actually reroutes that into the frontal lobe. Executive functioning, goal setting, all those different things that are higher brain functioning is what it's doing, right? Not to mention it improves proprioceptive input to the brain, right? It doesn't distort the messages, because when you have this thing called subluxation, which I was actually about to go through, when you're having these different things called subluxations, which are different distortions in your spine, it actually, when the information's coming in and your brain is going through and determining what's necessary to respond to, when that is distorted, that communication is distorted, what do you think will happen? What will the brain respond to?
Bad information.
Essentially bad information, right? And so that's how that is. And a lot of the time, when we're looking at that picture of the skull, most of the time with children who have ADD, ADHD, even autism, they have a lot of things going on in their upper cervical spine, in their upper neck, especially the upper two bones of their neck, right? They call that actually KISS syndrome, right? KISS. And it's actually in one of these slides.
I've lived my whole life with ADD, and that's where I had distortion.
Yeah, totally. Absolutely. Let me find that slide. And so this is the vertebral subluxation. So when we're looking at that picture of the skull, most of the time with children who have ADD, ADHD, even autism, they have a lot of things going on in their upper cervical spine, in their upper neck, especially the upper two bones of their neck, right? They call that actually KISS syndrome, right? KISS. And it's actually in one of these slides. Vertebral subluxation is significant because it actually causes not only a physical distortion in your spine, because this is what it looks like. This is what a normal head would look like, and a lot of the time this is what people actually manifest with. Okay? So now what do you notice with even just the arteries of your neck when it's in this tilted position? Yeah, it becomes pinched. And so not enough blood flow, oxygen goes to the brain. Right? And that's seen in many, many autistic ADD, ADHD children. Okay? It negatively impacts your overall well-being, not to mention your neurophysiological function. How you function in your daily life, that's how it affects it. Subluxation affects your function because it actually causes that disafferentation that we talked about, right? That dysfunction in the input to the brain. It causes that in all the cases that's ever seen. It also, like I said, decreases the brainstem and brain flow. And one of the most significant ones is cerebrospinal fluid. The way that cerebrospinal fluid is being pumped through your brain, right? Like I mentioned earlier, there's that saran wrap covering around the brain. So your brain is essentially floating in this fluid called cerebrospinal fluid, okay? And as you're breathing and moving, that gets pumped through. There's many different functions for that. It feeds your brain for one. And then it also, it takes out all the toxins from your brain that your brain produces, right? Have you guys heard this information before? So that's the significance of cerebrospinal fluid. Mechanical spinal cord tension. So as our spines get more and more distorted, our spinal cord actually stretches, right? And when you're thinking about it, I'll give you an example, like a guitar string, right? If a guitar string is really taut, it's supposed to play a certain note, right? Now, when you twist one of those things really, really tightly, does it play the same note? It changes the sound, and our spinal cord is essentially like that. It stretches and it doesn't, it doesn't play the right note correctly, okay? The reason why that is our spinal cord is actually anchored at our neck and at our sacrum. That's the main reason. Subluxation. Spinal dysfunction alters afferent input into the central nervous system. So it essentially distorts that message going into the brain, right? Like those 5 senses going in. Now, when that happens, it actually changes, it leads your brain to make plastic changes because your brain, right? Neuroplasticity could be good or bad, right? It could make not the changes that you want to it. And the last part is neuroplastic changes take both following increased and decreased afferent input. So it takes both of those things, less and more, all the time. So it's a balance, okay? Does anybody have any questions on any of that?
So neuroplastic changes are happening all the time, no matter what kind of input you're getting.
Exactly, and it could be for good or bad, okay. Right? And this is more research study on the neuroplastic changes that vertebral subluxation actually creates in the body. So why would it be so beneficial for children to actually have chiropractic care? Because it creates neuroplastic changes to their system, right, to their brain. It starts to actually rewire their brain to take a different route than it has been from before, right? Kind of like instead of taking the freeway, we took the side streets because there was a traffic jam, right? This one is from this book, Sensory Integration. All those different input coming in needs to be integrated into the body or into the system for it to actually have a certain appropriate output of information. Right? And that's that research study. And you'll actually get all these in your email. Okay. The next one, subluxation and fight or flight, right? When somebody has these different distortions in their spine, they're more than likely in fight or flight all the time. They're always in the gas pedal rather than the brake pedal. And Bruce Lipton, I don't know if you guys ever heard of Bruce Lipton before. He actually says you can't be in growth and you can't be in that at the same time. You can't be you're either growing or you're dying, essentially, right? You're either growing in a way where your brain is creating neuroplastic changes for the good, or there's no middle in between. Okay, you're leading towards health or you're not, right? So that's essentially what it's saying. Subluxation and autonomic balance. So this is actually one of I love this one because it actually talks about heart rate variability. Have you guys ever heard of heart rate variability before? So this is what we would call a gold standard for adaptability measure. It measures the balance between your parasympathetic and your sympathetic nervous system, your fight or flight, and your rest and digest, right? What would you guys think if we measured one of these kids who has ADD, ADHD? Would you say that they were more in balance or less in balance? They would definitely be not in balance, okay? And this is actually what it looks like. So we do this test on all of our practice members in the office. Where you want to be ideally is the green in the middle. Now, if you're in this out here, you're more in the challenge state, meaning you're more in your fight or flight. And afferent input or sensory things going into your brain is not being modulated correctly over time. And another one is, this is another thing that we measure, autonomic balance, right? So this is actually heat and inflammation in the spine. So it actually measures each one of those vertebrae. Where is the imbalance and how much of an imbalance is it? Because when you're measuring from side to side, the temperature should be pretty even, should be equal. If there is a significant amount, so it shows you in the color and as well as the length of the bar, it'll tell us you have more inflammation going on in that area, and that directly relates to a certain organ. And another one about CSF blood flow compromise. And this is mainly the misalignment in the upper neck, like I mentioned earlier, right? Because that's the junction where your brainstem actually sits also. Okay, your brainstem sits in this area, and that's where it is. C1 misalignment may also contribute to distension of the cerebral tonsils. So any distortion in the upper neck affects your brainstem and the flow of that cerebrospinal fluid. Okay. Now, what causes these different subluxations? You guys are probably wondering. It says it there, stress. That's the number one thing. And there's many different stressors: physical, chemical, and mental stress. Okay. What's a physical stress? Injury. Yeah. Kids playing, they fall down, they hit their head, whatever it is. Chemical stress. What are chemical stressors? Chemicals are, by definition, anything that doesn't belong in the body.
Poor diet or pollutants.
Yep, poor diet, pollutants, crappy water we're probably drinking, all the things, and then not to mention different medications that's not, belong in the body. All those things actually create subluxation and make things worse. And mental stress. Do you think the children have mental stress? They really do. They're not able to actually modulate the information coming in. And they get very stressed out. How common is vertebral subluxation? So this was a study done by the ICPA. 1,000 infants were checked in the first month of life. 80% were found to have vertebral misalignment in the upper neck. Because most people don't realize the very first time somebody actually acquires a subluxation is through the birthing process, right? I mean, the vaginal birth is pretty significant for not only mom, but also for baby, right? Especially when you're being put on your back right? That's very common. You lay on your back during labor in the hospital. You're probably given an epidural. That way you can't feel what's going on in your contractions. And so you have difficult labor. Now the doctor has to do all things necessary to be able to pull baby out of you, right? And they'll do that however way they can. They will yank baby out by their hands. They'll sometimes even suction them out. I don't know if anybody ever uses forceps anymore. I hope not. But I've seen that on, and it's pretty significant, right? And where does all of that happen? Right in that upper neck where we talked about. So that's really, really significant. But really, the most significant part of it is not the actual subluxation itself, right? It's the fact that most people don't know their children should be checked for subluxation. It's the fact that they're not looking at that as one of the causes of why they're having these imbalances in their nervous system, right?
I have a quick question on that.
Yeah.
So as a child, we're baby, we're not fully developed, we have the ability to be more flexible, and how are we able to verify a subluxation in an infant when they are still growing to the final stages of
Well, subluxation is defined not only as that, physical movement of the bone and it being stuck. So that would be one of the ways. So when you're feeling or palpating a child's neck, you could probably feel that, right? There is a certain tone and feeling to a normal spine of a baby. And when you're feeling that there might, I'll give you one really good example, if the baby's not latching correctly, that would be a really good indicator that they've got something going on in their upper neck, right? And most people don't really think about that. Latching would be one. Colicky syndrome. Those are one of the ways that people will know that their baby is subluxated if they're not latching properly, right? They prefer one breast over the other. They are colicky. They are not going to the bathroom regularly. That would be one. All those different things. And so that was those are most likely one of those measures in there. It's from a book. Yeah, so this one is, they were evaluated in the first 5 days of life. They were found that 90% of them suffered birth trauma and strain through the neck and cranial areas, right? When you're being pulled out of the birth canal, you're going to suffer some of those different things, distortions in your spine. The next one is that KISS syndrome I was talking about. So the medical doctor is actually talking about exactly what a subluxation is, except he named it KISS syndrome. So KISS syndrome is when, have you guys ever seen any kids who are just stuck in this way and they're kind of like that? You guys have ever seen that before? And so a lot of the time it's called torticollis, right? When their neck is twisted in this way and they can't really move it to the other way. So that would be that. And it's describing subluxation. And the primary risk factors of developing these things is long labor, C-section. Most people would think that C-section would be better because they're not actually going through the birth canal, but it's really not. They're still being pulled out the same way, and they're not being bathed through the gut flora of the mom. And then the next one is extraction with vacuum, twins or triplets if you're having multiples, and prenatal and positional anomalies. Okay. The birth process, even under optimal controlled conditions, is potentially traumatic, crippling event for the fetus. Spinal cord and brainstem injuries occur often during the process of the birth and frequently escape diagnosis. Now, I know we've been talking a lot about the really good effects of getting adjusted since we've been talking about this for people who have had things going on, right? Kids who have had things going on. But this is actually a study that I thought was really interesting, the side benefits. And this study was done on people who had nothing going on. They had no symptoms, they had no ill health or anything. And these are some of the common improvements in their health, even though they weren't really suffering from ADD, ADHD, they didn't have any birth trauma, anything like that. And so these are some things that they found. Autonomic function, right? Better regulation of sympathetic versus parasympathetic. Reaction time, right? Even in kids who get adjusted, even, they don't have ADD, ADHD. It improves their reaction time to things, right? Playing sports, different things like that. So that's one of the studies that they did. Now this is the child that's here. So these are some of the ways that we measure, like I mentioned earlier. These are some of the ways that we measure structural changes in children, okay? So this is a child. What do you notice about her on the left here? So red is her and green is normal. Do you notice any structural distortions in her spine like that we're measuring right now?
Leaning a little to the right.
Yeah, so if she were perfectly in line, she would be right aligned with the green, but you can tell that she's actually tilting to one side. Okay? Now this picture is really significant for everyone, not just kids, because you're noticing that her head is actually way in front of her shoulders, right? Today that's called text neck, right? Text neck. So a lot of people who are working on computers or their phones, this is what their head would look like. Now the weight of your head will actually cause stretching in your spinal cord, right? Do you think if a child would have that over a long period of time, do you think they would, be functioning normally or optimally, right? Kids, with that distortion in their spine often have trouble focusing because it's significantly stretching that vertebral artery as well. Not enough blood flow goes to their brain, right? Sometimes it's really not their fault. This next one, the rolling thermal. So we also measure that inflammation in the spine, like I mentioned, right? So this is a child who measured. So the red is a significant amount of inflammation in the spine, okay? Now, after getting chiropractic care, this is what changes. So their pattern also changes. So it significantly reduces the inflammation in their spine. Okay? And that's what that looks like. And what does a typical chiropractic session look like? If you've never taken your child to the chiropractor before, it's pretty interesting, right? So the session is essentially catered to the child, right? Spending a lot of time following the child around. You can adjust them in any position that they feel like. Okay? And most people, bless you, most people probably have perceived before that the adjustment is very forceful. It's in fact the contrary to that, because the system, right, if somebody's already hypersensitive, hyper-aware, do you think they would need a really, really significant and big adjustment? Right? Like somebody moving their neck a certain way and different things like that. Most children probably can't tolerate that. Okay? So it typically looks like for babies, the touch is as much as you would put on like a ripe tomato. And literally that's it. Okay? And also looks like different things. Does anybody have any questions on that?
That last change of the pressure,
Mm-hmm.
how many sessions was that?
12.
Weekly?
Mm-hmm. Yeah, so we do evaluations in here. There's, depending on what we find in your child. So the very most important thing is actually an assessment for the child, first and foremost. Because really your results will depend on where you're starting from, right? And so that's what we're essentially doing with the evaluation. Where is your child starting from? What is your child's history, right? What is your history? What's been going on in your life also, which affects your child, right? And so that's the most significant part of that. And so we measure it pretty frequently after we've created a program for helping them with their neurodevelopment.